Hello and good day to everyone. We are from Group 3. We'll be presenting on the safe medication quality care, a total quality management approach to eliminating errors and enhancing patient safety in Hospital Sultanabaya Kedah. So this is our group members consists of Dr. Muhammad Ashraf, Dr. Ahmad Faris, me, myself, and also Dr. Firdaus. So moving on, this is our table of content starting from introduction to synopsis and also assessment of the total quality management or TQM issues. The rest of the presentation will be presented in our final presentation later on. So as an introduction of our particular hospital, which is Hospital Sultanah Bahia. So Hospital Sultanah Bahia is a major tertiary hospital located in northern part of the Kedah, and it has total up to 910 beds with 17 specialties and 59 subspecialties. So this is our hospital milestone. The Hospital Sultanah Bahia start from the year of 1907 before moving on to the new place in year of 2000 and start operating of the new hospitals in year of 2007 and currently still fully functional up until now. So this is will be our hospital vision, mission, and also values. The vision is to be exceptional medical institution that is advanced and distinguished in Malaysia with mission of implement services that align with the MOH corporate culture. And our values will be the professional teamwork and caring. So Hospital Sultanah Bahia will cover the northern part and also central part of Kedah up to the total of 1 million population. So as I mentioned earlier on, this is our specialty and subspecialty of the hospital consists of 17 specialty and 59 subspecialty. So looking at this, our major hospital, this is our location of choice, specialty of choice, and moving on, our medication area will be presented by my colleague, Dr. Ahmad Faris. Thank you so much.
Thank you, Dr. Izas. Moving on, this is the synopsis or description of the quality issue for this topic. For the assignment, our group decided to venture into the area of patient safety, specifically on medication errors. To further understand medication error, all Ministry of Health hospitals in Malaysia follows the Medication Error Reporting System or MERS, which outlines the process for reporting and managing medication-related incidents. Medication error presents serious risk to patient safety, potentially resulting in adverse drug events, longer hospital stays, or even more severe outcomes. These errors can erode trust in healthcare service and may contribute to stress and burnout among staff. A comprehensive quality management approach is necessary to tackle these challenges, emphasizing process improvements and staff engagement. TQM offers an ideal framework for addressing the problem, focusing on continuous improvement, data-driven decision-making, and patient satisfaction. Okay. Before we look at the data available pertaining to this issue, let us first look at the flow process of prescribing medication. This is a general flow on how medication is being prescribed, which involve two levels of department, namely the ward or the clinics and the pharmacy department. Firstly, on the left side, the doctor or the prescriber would first write the prescription physically by the bedside for the intended patient. It is then passed to the pharmacy for the next process. At the pharmacy level, this chart flow is taken from the Malaysia Pharmacist Handbook. And number one, at the start of the process, upon receiving the prescription, the person in charge, which is the pharmacist, would screen and process the prescription. The pharmacist would validate, interpret, and check the availability and so on. As we can see, there are reconciliation steps or verification, which involve person A and B in order to prevent medication error. However, despite having these checkpoints, medication errors remain inevitable at the center. To simplify things, these are the main process. The one on the right, it begins with prescribing, transcription, dispensing, And lastly, the administration. We have identified multiple types of medication errors which occur at different stages of the medication process, from prescribing to administration. Below are the main types. Number one will be the prescribing errors, in which errors are made by physicians or other prescribers when ordering medications. It could mean wrong drug selection, incorrect dosage, inappropriate route of administration, or illegible handwriting, leading to misinterpretation. Next will be the transcription errors, in which the error occurred when medication orders are recorded or entered into the system. This could be due to misinterpretation of the handwriting or incorrect data entry into the electronic medical record. Next will be the dispensing errors, which are pharmacy-related errors, which occur when preparing or supplying medication to patients. It could mean wrong medication dispense, incorrect strength of formulation, or labeling errors. Next will be the administration errors, in which error that occur when medication is given to the patient. This could mean either wrong patient received the medication or incorrect dose administered. And next would be the monitoring errors, in which the error that is related to failure in assessing medication response to a medication, where not monitoring for adverse reaction would be one of it, and failing to check lab results for drug interaction or toxicity. The other one would be documenting errors, in which a mistakes in recording medication administration or adjustments. The others would be preparation error, which exclusively on the pharmacist, which incorrect dilution or mixing. Next will be storage errors, errors due to improper storage of conditions. And lastly would be communication errors, failures in communication between healthcare providers, in which may occur during handoff communication breakdown, poor patient counseling, or confusion due to similar drug names, or in which we usually use LASA, look alike, sound alike. Next, I shall pass the presentation to my colleague for a visual interpretation of the issue.
Thank you very much, Dr. Faris. So after a brief background of the medication errors, so now we shall explore on the data of the medication error uh, incidents in HSD. These are the data available for the year 2021 to 2024 for HSD. As you can see in this bar graph, we could further categorize the medication error into actual error, in which error happened and causing harm. Number two, near miss, in which error almost happened and caught in time, preventing them preventing harm. As you can see here, the average reported medication error is start around 300 cases for the year 2021 to 2022. However, due to increase of awareness among the healthcare worker, reporting increase in numbers up to 565 cases. These are the outcome of the medication error in 2024 based on the severity of the error. The table shows near miss constitute of 361 cases. Next, errors or no harm, 39 cases, and error and harms around 4 cases, which include causing intervention required and prolonged hospitalization. Next, from the bird eye view, we are focusing now to which process of the flow was the main culprit. At the prescribing levels, it is due to wrong dose and wrong dosage from form were the top cause. Next, at dispensing phase, the top two issues identified here is wrong drug and wrong strength. And lastly, at the level of administration, it was due to wrong drugs and wrong frequency mainly constitute the top two issues. So, for further analysis of the identified issues at different levels or stage, I shall pass the presentation to the next colleague. Over to you, Dr. Ashraf. Thank you.
Okay, thank you very much, Dr. Firdaus, for the presentation and my fellow colleagues. So, good day, everyone. So now I'll continue on to analyze the root cause of the medication error at Hospital Sultanah Bahia. Earlier on, my colleague has already showed the overview of the hospital and the background and also the situational analysis of the quality management issue. So now we have decided to use the fishbone diagram to showcase the root cause of medication errors. We also applied the Pareto principle whereby we identify the most critical issues under each category, which contributes the most of the error and should be prioritized for the intervention later on. So let's look at the first step, which is the method, under the method. So we have identified three issues, but the we have identified the three issues, but the two key issues here would be the complex and unclear medication workflow and also ineffective medication reconciliation step. So under the medication workflow, it involves multiple steps like prescribing, verifying, dispensing, administrating the drug, and also monitoring. However, due to the unclear role and inconsistent procedure, it can create confusion and increase the risk of error. And for the second key issue, the ineffective medication reconciliation steps, uh, this issue usually will lead to incomplete documentation or failure to review a patient's full medication history, which leads to discrepancy and also potential harm. Then let's look at the second one, machine or technology. So under machine, the biggest issue that needs to be addressed would be limited system integration or poor integration of electronic prescribing system. So here, even though we have electronic health record or EMR, they are not fully synchronized with the pharmacy and also medication administration system, which can create mismatched information, missing allergy alert, for example, and also potential dosing error. So the aim to improve the system interoperability is essential for patient safety. The other issues that we have identified is lack of automation and also ineffective barcode verification process. Then the third heading here, environment. While we don't identify any specific key critical issues, but all the three issues that is labeled here is actually also plays a role in medication error, like inefficient workspace layout in pharmacy and ward, poor lighting in medication and preparation areas, and also high noise level causing distraction during prescribing and also administration. Then under the fourth heading, which is manpower of people, we have identified two key critical issues here, which is human fatigue, stress and miscommunication, and also insufficient training on error prevention. So here we notice and identify that long working hours, night shifts, and also high patient load can lead to cognitive exhaustion, which can lead to more errors being happening. So additionally, not all staff actually receive adequate training on medication safety, which can increase the chance of prescription, misadministration, and also missed drug interaction. Another important point here is communication breakdown between healthcare provider. Okay, next under the fifth heading, materials. The most significant issue that we have identified is the look alike, sound alike drug packaging. So here, medication with similar packaging or names often lead to confusion during prescribing and dispensing. Without a clear labeling and distinct visual cues, the chances for us to actually select the wrong medication increase. Apart from that, the other two issues that we identified is unclear or ambiguous labeling and also poor quality medication and storage containers. And lastly, under the heading management, the key issue is the underreporting of medication error due to a blame culture and also insufficient staffing and high workload. So even though the hospital implement the medication error reporting system or MERS, many errors still go unreported due to the fear of blame and also lack of follow-up. Even when the reports are being submitted, also sometimes the corrective action are often not effectively implemented. So by addressing all these key issues, this root cause, through a targeted intervention, we believe that it can significantly reduce medication error at hospitals Sultanah Bahaya and also enhance the patient safety. So with that, there comes our problem statement that medication error at hospital Sultanah Bahaya threaten patient safety, prolong hospital stay, and also increase the cost. So all these errors stems from human factors, process inefficiencies, and technological limitation across prescribing, dispensing, administration, and also documentation. Despite the most medication error reporting system, underreporting and ineffective corrective actions can hinder quality improvement. Hence, we will try the total quality management approach focused on process optimization, reporting enhancement, staff training, and technology integration, which is essential to reduce error and improve patient outcome. So these are our references at the moment. Thank you very much. So for any questions and further discussion, you can put it under the discussion in Canvas later on.